Sure. Hi, I'm Betty Weiss from the Bainbridge unit, and I had suggested a conversation and a presentation about the Poulsbo CARES program after I saw it in another group. So that's what's next. And so I would like to introduce the presenters. I would like to let them know that we have people at least invited from Bainbridge, the North Kitsap unit, and the Bremerton unit. And of course, this conversation is specifically about something that happens in Poulsbo, but I think it's a topic we're interested in. I'm going to lower my hand. I'm going to suggest that as they're doing the presentation, that we hold our questions and put them in the chat or ask them at the end. And I'm going to ask all of us who are not speaking to make sure that we're muted. I see a few folks who have not muted themselves. So I will do the introduction and then I'll turn it over to Kim. She has a PowerPoint. And what I've talked with them about is that because this is being recorded, we can post it to the members only page so that anybody in the Kitsap League will be able to view the presentation. So Kim Hendrickson is currently the director of Poulsbo's Housing, Health, and Human Services Department. She's also the project manager for the Poulsbo Fire CARES program, and she helped develop the city of Poulsbo's Police Navigator program, which has evolved into behavioral health navigators working with police throughout Kitsap County. She's currently chair of the Washington State Co-Responder Outreach Association and a member of the state's Crisis Response Improvement Strategy Committee. She is joined by Chief Jim Gillard of the Poulsbo Fire Department, and he's been there as the chief for the last 4 years, but he has 33 years of fire service experience. He's president of the Kitsap County Fire Chiefs Association. He holds a bachelor's degree in fire administration from Eastern Oregon University and in economic geography from the University of Washington. So please welcome Kim and Commissioner Gillard, and we'll take it from there.
Thank you so much, Betty. Would I share my screen? I'm not able to. If you could make me a co-host, I'd appreciate it.
You should be able to do it because they've enabled anybody to be able to share screen. So you should be able to just do it. But if not, then Maury can push the right buttons to make you a co-host.
Thank you. It says host disabled participant screen sharing.
Appreciate it. So Maury, are you the host? Where are you? Can you enable?
Yes, I think I just enabled. I just made her co-host.
Okay,
that's right.
Yeah. And should I do that? Should I do the same for Jim?
No need. I'll be in charge of the slide deck today.
Okay. And now I'm going to mute myself.
Wonderful. Well, thank you so much for the introduction. Thank you so much, Chief Gillard, for joining me to talk about our shared program, Poulsbo Fire CARES. I see many familiar faces on this call. It really feels great to be able to talk about a program that's not only helping residents of Poulsbo, but actually is doing quite a bit of work in the greater North Kitsap area, including Bainbridge Island. So look forward to giving you some details. I want to start with some background and some information that I am certain most of you are already aware of, but I think it's important as backdrop before we go into the description of the Fire CARES program. COVID had an effect on all of our lives in a very dramatic way. And I think one of the long-term effects that it has had is really promoting more conversations and more hard conversations about the prevalence of behavioral health needs in our communities. When I talk about behavioral health needs during this presentation, I'm going to be talking about mental illness. I'm going to be talking about mental health distress. I'm going to be talking about substance use, whether that's drug related or alcohol related. And I'm also going to be talking about cognitive decline and the effects that changes in our brain has on behavior for people with brain injury and other kinds of afflictions. Again, what COVID has done, I think that will have a profound effect on us for years to come. It's really opened up a much broader conversation about the prevalence of behavioral health needs in our communities. As I think many of you already know, 1 in 5 adults live with some kind of mental illness. Around 1 in 25 adults live with what's called a severe mental illness, which is a mental illness that affects daily functioning, ability to eat, ability to walk, ability to live independently. We know for the National Center for Drug Abuse Statistics that over 12% of Americans over 12 use illegal drugs, and it's estimated that around 60% of us abuse drugs, nicotine and alcohol. We'll be hearing from Chief Gillard later about the effects that behavioral health issues and disorders have on our population, but one of the most dramatic effects is the increased use of our hospitals as places where people go in behavioral health stress. And it's caused a lot of stress on hospitals throughout the country, here in Kitsap County, a topic of interest in the chief, and I think of many people on the call as well. Suicide rates have been rising across the United States, and particularly among our youth population. A terribly depressing statistic that you might be aware of is that suicide is now the second leading cause of death in Washington state for youth between the ages of 10 and 24. I don't want to go into any more detail about behavioral health distress in our communities other than to say the trends are not going in the right direction. Even now that COVID has passed, we're still seeing an uptick in many of these kinds of calls. And I think it's important to say that there are many people in our communities that are able to proactively manage their behavioral health conditions. Treatment works, having support systems work. There are many people that have mental illness and substance use disorders and are able to effectively live their lives, but there also are many that can't or won't. And the topic of our conversation today are folks in that smaller, latter category because of lack of capacity or lack of means or lack of support, and in some cases, lack of insight, are unable to get the help they need to address their behavioral health needs. And here in Kitsap County, a very pressing consideration is the fact that we have an appalling lack of resources as well. We have a dramatic lack of supportive housing for people that need extra levels of care. We're struggling with a lack of in-home caregiving services, a lack of appropriate treatment options for people, particularly with severe mental illness. And even for those that are just struggling with mental health concerns that don't need a higher level of treatment, the waiting list for appointments and prescribers can be months long at this point with very dramatic effects. And of course, the situation is always worse and harder for difficult with people that have limited funds and limited support systems. There is a prevalence of 911 calls that are made involving behavioral health issues. It's hard to find an exact number to measure how many times 911 is called to address unmet behavioral health needs, but the estimates are somewhere between 10 and 25% of all calls coming into 911 involve somebody in some form of behavioral health distress. Now, as Betty mentioned, I have the honor of sitting on a state committee called the CRIS, the Crisis Response Improvement Systems Committee, that's working really hard to figure out how we can make our new 988 number in Washington and a new 988 system in Washington be more responsive to people that are in behavioral health crisis, so folks don't have to be calling 911 when they're in distress, so we can have alternative responses to people struggling with behavioral health issues. There's an ongoing state and national conversation about reducing the use of 911 for behavioral health calls, morphing things over to the 988 system, which is something I'm involved in and very much support. However, that's going to take a long time. It requires systems change, it requires money, it requires new kinds of providers to step up to the plate. And in the meantime, 911 will continue to be a resource that people use when they are in behavioral health distress, because at the moment, unfortunately, there really are very few other options to call. I mentioned before that estimates range from 10% to 25% for calls coming into 911 involving behavioral health. If it's coded as any calls that are responded to police and fire, some of them that are self-initiated, Sometimes I've heard the estimate go as high as 50%. Again, it's hard to find exact statistics in this area because these numbers are so hard to record. Just quickly, I think it's important for us all on the call to realize that even when 988 systems are more robust and effective, there will always be a role for 911 and first responders in some way to respond to people in behavioral health crisis. And that's because of safety issues that are sometimes present in these calls, medical issues that are sometimes present in these calls, the need for transportation, especially quick transportation when somebody is in crisis and needs emergency care, requests from folks in the field that are acting as behavioral health professionals that often won't go to these calls without police or fire backup for a variety of reasons involving medical need and safety. There's a trend in Washington state that police are less and less involved in these calls. And that's for a lot of different reasons, some of it internal, some of it external laws and pressures. But as police are doing less of these responses or are looking to reduce their role in this area, a heavier burden is falling on our friends in fire and EMS to provide responses to these behavioral health crisis calls and to do so in an effective and humane way. A very important part of the conversation about, right, who responds in a crisis, what happens when you call 911, what's the appropriate response, has to involve the critical role of fire and EMS in responding to behavioral health issues. And let me just stop the presentation for a minute and say something that maybe not everybody on the call might understand. Here in Washington state, fire and EMS is very tightly connected. In other states, there are many standalone EMS services. Chief, please jump in and correct me if I'm misstating this, but Washington is unique in that the vast majority of emergency medical service providers are within fire departments. Chief, have I said that correctly?
No, that's absolutely correct. And in Kitsap County, all of the EMS, with the exception of the city of Bremerton, that has a private ambulance company that does their low acuity basic life support transports, all of EMS in Kitsap County is provided by the fire departments. In Poulsbo, Bainbridge, and Central Kitsap, every response is solely handled by the fire department.
Thank you so much, Chief. And probably important for this audience to understand, while the fire-related services that fire departments provide, of course, are absolutely critical, the vast majority of work that fire departments do relates to medical needs. So EMS has become really a core function of fire departments, particularly in our area. So when I talk about 911 response and behavioral health response, please understand it in this larger context of fire being so devoted to emergency medical response and attending to the medical needs of residents. As you know, I work for the city of Poulsbo, so I'm particularly interested in the work of the Poulsbo Fire Department. We know that in 2021, there was a pretty dramatic increase in behavioral health related calls. In 2021, again, this is affected by COVID, a 9% increase in total call volume, a 42% increase in overdose related calls, a 25% increase in suicide related calls. So these are calls that affect all of our communities, the small ones, the urban ones, the large ones. But it's really become a very important part of the fire service here in Poulsbo. So for that and other reasons, City of Poulsbo went to the Poulsbo Fire Department back in 2021 and asked if they might be interested in starting a partnership to start something called Poulsbo Fire Cares. Poulsbo Fire Cares partnership started in January of 2021 and just came from a very simple question. How do we respond more effectively to 911 calls that are involving behavioral health? And the basic concept was worked out over time and is now very much in effect. The basic concept here is combining a firefighter EMT, or an emergency medical technician, with a behavioral health professional. We tend to use social workers. We like them very much. And this team works in the field, typically after a 911 call and a crisis has been resolved, to work with individuals and their families to connect to needed resources. And the purpose of this program, really more than anything else, is better patient outcomes, reducing the use of hospital services by being able to prevent crisis, and stabilize people in their homes or in communities, and reduce that use of emergency systems like the emergency room and 911, when many issues involving behavioral health could be better resolved over time by connecting people to resources. We take a regional approach in our partnership. As I mentioned before, we're not just a Poulsbo program. We serve Bainbridge Island, Kingston, Suquamish, Port Gamble, Sklallam, hoping in the new year that we expand to other parts of the county as well. Chief, I think I'll turn to you if you don't mind. Could you speak about what the CARES team does in the field, particularly how it takes referrals?
Sure. Well, most of our referrals come from our emergency responders, both law enforcement and fire. And what we see when we started this program, it was really focused towards behavioral health. And we saw it expand really quickly into the elderly population, so many other folks in our community who needed help. How I phrase a lot of what the program does is a lot of folks in our community get in a cycle where they'll have a crisis event, a mental health crisis, a drug abuse crisis, a fall for someone who's elderly, or an issue with Alzheimer's or dementia. And they'll call 911, and usually the fire department or law enforcement will respond, will treat them. And if it's a drug abuse issue or something with a legal aspect, then they may get taken to jail, or more than likely the fire department will transport them to the emergency department. Emergency department has some wonderful people, wonderful nurses down there doing great work, but they're there to treat the acute issue that's going on today. If someone falls, they're going to mend the bone that's broken. If there's a drug overdose, they're going to give them medication to counteract the drugs. But then a lot of times they get put back into the community. They get sent back home with no resources. And in so many of those instances, what we saw was that person was left for the exact same situation to happen again. So they'd go back to their home, they could fall again, they'd overdose on drugs again, they'd have a mental health crisis again, and they'd call 911. We could take them to the emergency department, they'd get released, and they're just on this cycle of repeated reliance on the EMS system and the emergency department with no one addressing the root cause of what was going on. So to me, that's where our CARES team is so incredibly successful, is they get referrals from our emergency responders that a member of our community, they saw something going on in their home that's causing the crisis. They refer them to their CARES team. When they're released from the hospital or in jail, they work really closely with police navigators who do a similar work, but on the legal side. And they contact people out in the field, in their home, or if they're homeless out in the community, they contact them and they really try to get to know the individual and what do they need to make sure they don't go into crisis again. And a lot of times those resources are available. They just need someone to put the dots together, to find them, to connect them with the right resources for mental health, for drug abuse treatment, for fall prevention, just letting families know that there's someone elderly who needs help, trying to make those connections to prevent the next crisis. And that's what that team really does right now, is they're preventing the next crisis, which from a business standpoint of running the fire department is a much more efficient manner of serving our community. It is far more efficient and cost effective to prevent the emergency than having our emergency response crews go with a medic unit, a fire engine, treat the person, transport them, taking that medic unit out of service to transport them to the hospital, taking up the emergency department's resources to treat them. How much more efficient to find them the resources they need so they don't go into crisis again. And way more importantly than the efficiency aspect is it actually saves lives. Getting that person the substance abuse treatment, getting them into a program where they don't overdose again is going to save lives. Getting the elderly person some fall prevention devices so they don't fall again will save them and prevent injury. And that's really what they're focused on doing. And Kim, if you can indulge me, I have an anecdotal story that I think sums up. We do a lot of metrics in how many people this team is serving in our community. Even in Poulsbo, which I always refer to as Pleasantville, and in Bainbridge and North Kitsap, this team is busy with folks who need help. They're busy, but so we keep the metrics so we can analyze what the team's doing and how many people they're helping. But one of the best stories I think that sums up what they do was there was a gentleman in Poulsbo that was kicked out of his halfway home. I think it was a YMCA home because he was abusing alcohol, serious alcohol abuse issues. I think it was law enforcement alerted our CARES team that this gentleman in a wheelchair, and it was back in the early spring, late winter, was in a wheelchair in front of the Red Apple Market on Viking Avenue with nowhere to go. So that is a typical person who is going to become homeless, living on the street, begging on the street, going into crisis because they can't care for themselves. That's what generally happens. Our CARES team made contact with the individual, talked to him, learned his story, got a hold of the halfway home that he was just kicked out of, talked to them about what the problem was, got them to commit that if he went into an alcohol treatment program, they would take him back. Our team spent hours on the phone, found the gentleman a substance abuse treatment program in Tacoma, found him transportation to the treatment program in Tacoma, and got him put in that program with the commitment that if he finished it, he could go back to the halfway house. Now, we didn't follow up. I don't know what happened to that gentleman, but I know that because of the CARES team, we gave him a chance. We were able to connect him to the resources to be safe, to get treatment for the alcohol abuse, to get back to the halfway house. Without that, he'd be another person on the street going into crisis, calling 911, going back to the ED. And that's just an anecdotal story that I think really well sums up what our team is trying so hard to do. And Kim, I apologize, I was long-winded there.
Oh,
but
no.
when you asked
Oh,
what we do,
please.
I think that's a great description of what that team does.
What I learned long ago, Chief, is it's much more interesting when you speak than when I speak. So please talk away. But I will pick up on something that you said, because I think it might be of interest to some people on this call who are interested in medical care more generally in Kitsap County and what we're doing to improve choices and the ability to get medical services for people that need it. Something that you alluded to that I just want to emphasize is that we have services in this county, not enough, but they tend to be very siloed off and non-communicative with each other. So, first problem, we need more. But second problem, for the services that exist, because of HIPAA, because of privacy considerations, because of the way systems are set up, it's very difficult for agencies to communicate with each other. So that gentleman in a wheelchair outside of Red Apple, it's interesting that he could be a client of, I'm just going to make up names now, but he could be a client of PCHS, or he could be a patient at Kitsap Mental Health Services. And the halfway house may not have the ability to contact a medical provider or a behavioral health provider to let them know what's happening to their patient. One thing that the CARES team does that's incredibly impactful, it serves as an information hub. The CARES team gets that 360 view of an individual that needs help and is able, not just once, not just twice, but on an ongoing basis, to reach out to the different providers that might be touching that individual to make sure that there actually is some kind of care coordination. Without programs like CARES, right? Providers see only through their limited range what's happening to their patient. They don't know what happens at home. They don't know what happens in the hospital. They don't know what happens between appointments. Because CARES is a team that works in the home, that works in the community, that's able to follow up on 911 calls, the team just has a much more holistic picture of what individuals need and can work on an ongoing basis to take this really disaggregated and often dysfunctional system and make it work a little bit better in a person-centered approach. Chief, you alluded to hospital. I'm going to put you on the spot. I know that you have been very active in this county in talking about the wait times at St. Michael Medical Center, and you've been very active in looking for solutions with St. Michael to this problem. How does a team like CARES prevent folks going to the hospital so we can reduce the wait times at hospitals and keep more people at home that don't need to go to the emergency room?
Well, thank you. And yes, I have been fairly outspoken, I think, in my frustration with the ED wait times and making sure that members of our community can get prompt emergency care when they need it. And we've been working collaboratively with leadership at St. Michael's to try to solve what I call the ED crisis. I think it is a crisis when our community can't depend on the emergency department for prompt emergency care. So we're actively fighting to make sure that we can solve that problem together. But we are also, and not just putting the blame on St. Michael's, there's a lot of community issues that are going on. There is a complete over-reliance on the emergency department for basic medical care. That is a lot with the structure of medical care in our country, and where funding goes. A lot of these issues, you can follow the money and you can find the root cause of what's going on. But too many people are going to the emergency department rather than going to their primary care physician or going to urgent cares to see that kind of care. So the emergency departments are being overwhelmed by that. What we're trying to do is be proactive, and again, going back to preventing the crisis that needs someone to go to the emergency department. We are really big, and we've really embraced in our organization that prevention is being a core function of what we do. Every time that we can get someone out of that cycle of reliance on the EMS system in the emergency department, we take a patient out of the emergency department, hopefully get them the care to solve the root cause of what's going on. And now there's a bed free in the emergency department. Now, the numbers are really small. The number of people that we're actually taking out of the system is pretty small compared to the scope of the problem at St. Michael's. But just sit back and just say, well, the problem's too big, or there's nothing we can do about it, or, and even more cynically, that with transport fees, well, the department gets reimbursed for transporting. We just keep doing that. We just keep breaking in that revenue for transport fees when there's people who are having crises that we can prevent. We can take that. We can operate the system much more efficiently to keep them out of the back of the medic unit, to keep them out of the emergency department, and get them the care they need. I hope that answered your question, Kim.
Perfect. And it leads into common calls. Chief, you already alluded to one particular incident earlier this year with a gentleman in a wheelchair. Let me talk about a common call involving suicidality, because I think that speaks directly to keeping people out of the hospital that would not benefit from that experience. We have a policy, informal and formal, here in Kitsap County, where when somebody's expressing thoughts of suicide, it's protocol to go instantly to the hospital. I don't know how many of you have had the misfortune of having to go to the emergency room, but it can be a very traumatizing experience. As Chief has already alluded to, the waits can be long, hours to get in, and once you're in, hours to be seen. If you're somebody experiencing a behavioral health crisis and maybe have thoughts about suicide, it's not the most appropriate way to handle the situation, to have you waiting in an ambulance and then waiting in a room for many hours and then being released because there's really not much the hospital can do. If we can use CARES, right, to create more of a support system for individuals in the home, in the community, if we can attach people to care with next day appointments, case management in the home, and avoid hospital trips for individuals who are expressing suicidal ideation, I think it would be a great benefit to both individuals and the system itself. There are times that a hospital visit is mandatory after attempts are made, but there are instances where sometimes people just need more support and more help, and taking them to the ED can actually be worse than keeping them in place. Kind of call that CARES responds to with some frequency, and it's back to what the chief said about serving many people that are aging in place, helping people that are disoriented. We respond to calls with some frequency of people that don't know where they are. They have lost the ability to realize where their home is. Locking yourself out of the house and not knowing how to get back home results in a 911 call, and that certainly is not appropriate for a hospital stay or a hospital visit. That's the sort of situation that CARES handles much more effectively by getting in touch with family members, by getting in touch with people that can do an assessment for dementia or other forms of memory decline. Another kind of call we respond to with some frequency are people that are overindulging in alcohol and falling as a result. When somebody is hurting themselves through alcohol use and then falling, trip to the hospital can be helpful, but we have found it's far more helpful to be able to address those underlying needs and to get people the ongoing outpatient help that they need instead of a hospital visit that can often result in a long wait, a determination that not much can be done, and then just a return right back into the community. We have many more stories to tell, but I think I'll turn just more generally to how it's going. The team has been in service now for a little over 18 months. We started in January of 2021. Here we are already in October of 2022. I can't believe it. The size of the team has grown. As I mentioned before, we started out with 1 firefighter EMT and 1 social worker. We've now expanded to a firefighter. We're bringing in part-time firefighters that can work on the weekends. We have 2 social workers employed with fire cares. We have a part-time substance use disorder professional that can do things like substance use assessments in the field and help, as the chief suggested before, with transportation to different facilities across the state. And starting in a couple of weeks, we have a new position starting called the Geriatric Case Manager, somebody that will join the team on a part-time basis specifically to attend to the need of older adults that are calling 911 to address underlying issues. We think we can be much more effective with more home care and somebody with a specialization in that area to give more focused attention. We have already talked a little bit about our approach. It's very much a regional approach and not specific to Poulsbo. We've assisted well over 400 individuals. Nearly half are 65 and older. We track the numbers of connections that we make to behavioral health, physical health, social and support services. And we also track the number of times a hospital trip is avoided. These are statistics that I'm very proud of. We do a survey at the end of the year and ask people that work with our program how they think things are going. 93% of our survey respondents reported satisfaction with our service, 78% extremely satisfied. The first responders that we work with and accept referrals from are very pleased with this kind of approach. And maybe most importantly, the first responders that we work with think that this approach reduces 911 and emergency system utilization, which is such an important goal. And with that, Chief, I'll just turn it to you. Are there things that we didn't discuss that you'd like to bring to this group's attention?
Well, I could talk for quite a while, but I am much more interested in answering this group's questions if they have any.
Delight, are you going to moderate questions or do you want me to?
Well, go ahead, Betty.
I think you should moderate them, Betty.
Okay. First of all, I'd like to say thank you. I saw this presentation maybe a year ago, and the program is certainly bigger than it was at that time. I guess I would open with a question relative to Bainbridge specifically, since I'm a Bainbridge resident. So are you connected with the fire department on Bainbridge, the police department on Bainbridge? I think Bainbridge has a navigator. So if you could just speak a little bit to what you know about how this is working on Bainbridge.
Sure, I'll kick off with that. We have a great working relationship with Bainbridge Fire and North Kitsap Fire and Rescue. We share a lot of resources and a lot of resources to serve the communities as efficiently as possible, and this is one of them. Poulsbo, centered around the city of Poulsbo, we have this CARES program. So we provide the service out to Bainbridge Island and North Kitsap, from Suquamish all the way up to Hansville, and we treat those communities just like our own. And we receive referrals from their fire departments and law enforcement, both Bainbridge Island and Kitsap County Sheriff's Office. There hasn't been as much or it isn't a high utilization on Bainbridge. Bainbridge, in a lot of ways, is very rich in resources for folks who are experiencing crisis. But when we get a reference from their fire department for someone that they're seeing a lot, our team goes to Bainbridge and acts like they're in Poulsbo. Yeah,
let me add my 2 cents to that, Chief. would like to reiterate the fact that we've got a really great working relationship with both the fire department and the police department. As folks on this call may know, the Police Navigator program started in Poulsbo, and Bainbridge Island saw fit to develop its own program based on our successful track record. So we have a very good and close relationship with the Police Navigator over at the Bainbridge Island Police Department, who makes not frequent but effective referrals to us when there's individuals that she's trying to assist that would be better served by a fire response than a police response. I can tell you that I've done a few of these presentations in the past few months, and I'm hearing over and over again from folks from IVC, Island Volunteer Caregivers, and from the Bainbridge Senior Center, that they see a need for a more robust fire care service on Bainbridge Island. So I do hope we can keep working with the Bainbridge Fire Department to be able to offer more services on Bainbridge, because even though our referral numbers are still relatively low, we're hearing from folks at IVC and the Senior Center that they know of situations where people would really benefit from this sort of like slow and deliberate case management approach that CARES takes, and they'd like to know how they can use our services.
Okay, I'm going to take the question from the chat and then Martha. So the chat, what kind of vehicle does the CARES team use when responding to a call?
They're utilizing an SUV. It's very low key, but that's what they use. It's so much more efficient than the use of a medic unit or a fire engine. And it also, one of the great things about the team is they're very casually dressed. They're really intended to be a low barrier, especially with the homeless community and folks with mental health. We really try to make them as approachable and accessible as possible.
No lights and sirens, right? There's a nice looking SUV with a friendly logo on the side. And I keep coming back to like a trauma informed approach or a trauma responsive approach when people are experiencing tough times and crisis, right? The last thing they need is lights and sirens. We're really trying to approach this from how does it feel to be the individual needing help.
Martha Burke and then Carolyn Berger.
I was wondering, I believe that North Kitsap, the police and fire, or fire at any rate, has a levy. It has something on the ballot this fall. Is there any connection? Will any of that help to support something like what you're describing with this CARES, or is it totally separate? Do you know?
No, it's part of our budget, and having sufficient funding is definitely, part of what allows us to sustain the program. Poulsbo Fire, we've gone through a change in the last couple of years where we've fully embraced prevention, both fire prevention and EMS prevention as core functions of our organization. In some organizations, and traditionally, these are seen as support functions or other things, where our real role is responding to emergencies, which we still do that, but we've really embraced these as core to what we do. It's part of the service level that we provide to our community. But in order to sustain those services, we need sufficient funding. So we are running a fire levy. There's just so much growth in our community that we really need to start expanding our emergency response and our prevention services to keep up with the growth. And that's the same for both Poulsbo and North Kitsap Fire and Rescue, and South Kitsap are going through that same growth right now. And it's really been interesting to see just how much our call volume has been increasing. And really, when you look at the city of Poulsbo, how much it's really transitioned from a quaint little town to a city and a lot of the city issues. And we're trying to keep up with that. So did that answer your question, Martha?
Well, so that North Kitsap is included in, you are both in that same levy? Is that what you're telling me? That's going to cover these areas. I mean, not just Poulsbo, but also North Kitsap.
Correct. So our CARES team provides service to North Kitsap and Bainbridge. North Kitsap Fire and Rescue is separate than the Poulsbo Fire Department. So I'll take 30 seconds to describe this because I think we've made it as confusing as possible. So the Poulsbo Fire Department is not part of the city of Poulsbo. We're a separate fire protection district. And we serve the city of Poulsbo and unincorporated Kitsap County from Keyport up to Port Gamble. North Kitsap Fire and Rescue is a separate fire district that serves from Suquamish up to Hansville. So we get along great. They have absolutely wonderful people working there. I a lot of times describe it as two fire departments serving one community, which in some ways doesn't make a lot of sense, but we do share a ton of resources. Our firefighters train together. We handle each other's calls for each other. We work really well together. And this is another example of that. North Kitsap Fire and Rescue that serves Kingston doesn't have a CARES team, but we do. So we provide that service to them in exchange for a lot of the services that they help us out with.
Okay, and
But
this
they are
levy will cover
different fire-
both areas.
Yeah, they're two different fire districts. We're each doing our separate fire levy renewals.
Okay, thank you.
Carolyn Berger, I think you were next.
Yes, one was just sort of a comment because it's National Suicide Prevention Month, and just making sure people in the call could talk to people, friends, family about safe storage if they have guns in the home. So just putting that out there. And the other thing I'm curious about is when calls come in, like if you're concerned about a family member in the county, how are those, for whatever reason, you haven't heard from them, or there's a health issue or a substance abuse issue? I know in other counties, there's like a human resources office you can call and somebody does like a well check or something. I don't know what it's called exactly. How does that work in Kitsap County?
So welfare checks are something we do. Generally, welfare checks are handled by law enforcement. It depends on if there's any kind of medical component to it, as in my grandma was sick, I'm worried about her, I haven't seen her. If there's a medical component to it, then they'll dispatch the fire department and we'll go check. A lot of them that are more, I just haven't heard from so-and-so for a while, law enforcement will handle. It was a huge issue last year when some of the law enforcement reform came out, where some of the law enforcement agencies were very concerned about handling any issue that was not directly related to a crime. And we worked with our law enforcement partners. It really brought the fire and police chiefs together to solve these problems, to make sure the community was served while we got clarification from the legislature. An anecdotal story, there was a gentleman from who was a veteran who the veterans helpline was concerned about. They hadn't heard from him. They were concerned about his mental state. They called our 911 center. They alerted the sheriff's office. They hadn't heard from him for a while and they were worried about him. Sheriff went up to the home. There was no answer. Had some impression that there was somebody inside. I can't remember the details, but had the impression there was somebody inside that wasn't answering the door. They called for our help. We broke in. The gentleman was in a severe medical crisis. Our crews, our paramedics treated him, transported him to the hospital. And it was that exact situation that if we didn't have that system, if the sheriff's office wasn't proactive and wanting to respond and help our community, it probably would have been a different outcome.
Mm-hmm. Thank you.
Let's see. So there's a question, two questions.
Betty, I'm sorry, Betty. I just wanted to acknowledge Carolyn's comment about
okay.
safety locks.
Yeah.
That really resonated with me, Carolyn. We have been making efforts to equip the CARES vehicle with gun locks, so we have them available instantly. It's not easy. Yep, it's logistically more challenging than we thought, but know that there is an interest in moving in that direction at the fire department and with the city. And if you have any interest in helping us with that aspect of our program, would welcome the conversation. Thank you.
And Robin asked in the chat, and I think Kim answered, but do you foresee CARES teams being formed in other Kitsap fire districts? So Kim, do you want to just say what you said?
Oh, I think better the chief handles this one. Thank you.
Oh, okay.
So I work very closely. The Kitsap Fire Chiefs, we meet every week. It's a great group of individuals who really want to serve their communities, and we do that better when we work together. The CARES programs are very popular and very sought after by the other fire districts. We just had a meeting with the chiefs from Bremerton Fire, Central Kitsap, and South Kitsap that are trying to put together CARES programs or EMS prevention programs like this because they see the value. What they don't have is they don't have a Kim. They don't have somebody at the city, at their local city, who is such an advocate for this and can dedicate the time and resources to make this happen. So the other fire districts, we're working together to try to expand this program. We're on the path to expand the program to Central Kitsap next year. But it is also difficult. It takes a lot of resources from a fire department to implement this kind of program, and they really have to commit a lot to it. I do think the other fire chiefs want to implement these programs. It isn't easy. And really what they need is they need a strong partnership with the city or the county that can provide the social worker aspect of it. And we're trying to help them as much as we can make that happen.
I was going to add a question is, what's the availability of social worker and behavioral health people to bring on board? It seems like that's already a dearth of that kind of capability, in general. So how do you attract them to work with you?
Boy, that's a very big question, Betty, and I have a couple of different ways of answering it. First and most importantly, you have correctly identified a terrible workforce issue where we have a dire shortage of mental health professionals, not only in our area, right, but in our country. It's a very significant problem, and I really commend the UW for starting a program this year along with a philanthropic organization. I think it's the Sackler family. Please forgive me if I've gotten it wrong, but there are now master's programs that are offered at no cost for people that are interested in getting into this profession. We desperately need more mental health professionals. So on a larger level, yes, I'd like to just affirm that we have a workforce shortage. However, we have found that much, or at least some of the workforce shortage has to do with the low pay at community behavioral health agencies, and working for the city of Poulsbo brings with it higher salary, pension, benefits, a kind of job security, and a kind of freedom to do the work that a lot of mental health professionals want to do out in the community with people doing impactful follow-up, person-centered work that they're not able to do in an office setting. So while, again, I completely acknowledge workforce shortages, I can tell you that because these jobs pay fairly and they allow people to pursue maybe what they emotionally want to do and aren't able to do in an office-based setting, we have been able to successfully find staff for the programs.
And let me just echo a couple of the comments Kim made. There is a shortfall in social workers and there's a shortfall of nurses. There are more jobs than available. But what we keep seeing is a lot of those shortages, like Kim had mentioned, are based on wages and working conditions. So unfortunately, and I'm going to speak probably too freely, some of the local organizations that are some of the largest employers of those roles have not had the best work environments. So they've lost a lot of highly skilled people who are committed to serving our community, and it's really sad to see. What we found is with our social workers, because the city of Poulsbo is paying them a fair competitive salary, and also it's a good place to work, they enjoy the work, that we have not had as much of a problem recruiting folks to fill the social worker role.
Thank you. Any other questions, comments from anybody? I'm doing this thing looking for, Carolyn Berger has her hand up. Thank you. You're muted.
On Bainbridge Island specifically, the doctor's clinic closed down, which meant thousands of people without doctors. And it's an interesting thing to observe within our community, because some people were able to go find sort of this concierge medical care. But I know of a lot of people that haven't found doctors, and I don't think it's necessarily at a crisis point, but I just wonder, especially for older folks that maybe haven't been able to get out there and find a doctor, figure out where to go for care. Because I mean, I'm in Seattle now trying to get care, and yeah, I wonder if you have seen the impact of that clinic closing.
I'll take that. Yes, we have on Bainbridge specifically, and in Poulsbo. Unfortunately, I'm going to try to stay out of the politics of money in healthcare, and especially the primary provider of healthcare in our community with CHI. We've seen in Poulsbo, they closed the largest urgent care in Poulsbo, and they closed the doctor's clinic on Bainbridge Island. So those folks, a lot of those folks who relied on that are now relying on the emergency department. That's where they're going because their urgent care closed. And I'm sorry, but it's infuriating to then hear the complaints of, well, our ED is too full of people that should be going to emergency, or urgent cares. Well, CHI, you close the urgent care centers. So it's really frustrating. But again, that's kind of the structure of our healthcare, where profit and financial stability, I guess is probably the more correct way of saying it, is a major concern of healthcare providers. So yes, to answer your question very directly, we have seen a significant impact by the closure of those facilities.
Evelyn, you posted a question. What about volunteers? Could you clarify what you mean? Like, are there ways that we can volunteer, or how much of this is provided by volunteers? What would you clarify your question?
I guess I'm asking, do they have volunteers and do they take volunteers? I'm a psychiatric nurse.
Oh, I'm so happy to get that question. So happy. So we have a new initiative that we're really just launching now. I'm going to try to show it on my screen, but I'll also send a copy of this to Betty that hopefully she can distribute it. We're starting something called, oh goodness, I'm sorry. Well,
I think you need
called,
to turn it.
it's called
You can send it. Yeah.
I'll send it to you. And also over in the chat box, I put a link to the website that describes the Poulsbo Fire Cares program. If you can get over to that website, there's a new initiative starting called Poulsbo Senior Cares. This is a program where we'll be enlisting volunteers wherever the CARES team operates. So now it's throughout North Kitsap and Bainbridge, to provide some volunteer phone support service for older individuals that our Fire Cares team is serving and realize would really benefit from a weekly or a bi-weekly telephone call. We'll provide training for our volunteers. Everybody will be screened by the Fire Cares team. We're working with a former employee of the Aging and Long-Term Care here in Kitsap County, so we'll be plugged into to resources and services. As we've mentioned many times during this call, we're very concerned by the high number of older adults that are using 911 to address underlying needs. I think that by using volunteers to just provide some friendly, regular check-in, we can start to chip away at this issue. It's not going to solve it, but it certainly will address it in some way. So we welcome volunteers, particularly that are interested in talking on the phone to isolated seniors. And frankly, in my opinion, I think seniors are the best volunteers and would do a great job connecting with other seniors. So please look at the website if you're interested. Information about how to contact me is listed there as well.
And can I add, with volunteers outside of just our program, the NGOs in our community that are providing social services to our community are so amazing. It is so heartwarming to see how many people are volunteering their time and effort to help in so many different ways, from meals to, putting up fall prevention devices. So many people are volunteering to help in our community. And that's what our CARES team does really well, is connecting the people who need the help with the volunteers, a lot of them volunteers who want to help and want to serve. So the volunteerism in our community is strong, and it's amazing to see that work. And sometimes it works so much better than the organizations that have to worry about financial stability and billing.
Barbara Paul, did you have a question?
Yes. I just wanted to make a comment here. because I'm still serving on the Kitsap County Division of Aging and Long-Term Care Advisory Council. And that is another agency which clients are basically seniors and people with disabilities, where if you're needing to find a physician in the area, this is a good place to call. And I know they're working, with the fire department and CARES, and you guys are doing a really great job. Thank you for that.
Oh, thank you so much for that acknowledgement. We so value our partnership with aging and long-term care. It's become such a central part of what we do. And the fact that we can refer people to aging and long-term care for that sort of resource guidance, but then they can call us when they're concerned about somebody that they need to see, because they realize that we're in the home and we can go eyes on to somebody that they're concerned about. So we can do that sort of care coordination that's so critical to success. So glad you said that, Barbara. We love aging and long-term care. Thank you.
Thank you.
Okay, if there isn't anything else, and I don't know what time it is, so we're just have a few more minutes, but if folks are done, then we can let the chief and Kim get back to helping people and saving people.
Well, I want to thank you both for an excellent presentation. It was very informative to me as a Bainbridge Island resident, and I'm glad to hear that we're working together with you. So thank you, and thank you, Betty, for moderating this. Martha, do you have another question? Or,
that's my reaction. It's a way of saying thanks. It's a great show. I really appreciated it. Thank you.
Well, could you guys allow just a quick comment from me? I'm sorry to take more of your time, but
No, we're still in. So anything from either of you is entirely welcome.
Well, I just need to acknowledge Maury for all the work that she has done around suicide awareness and prevention. So much of the work that we've done at Fire Cares comes from her example and lessons she taught me long ago. And Ann Blair, conversations that we had many years ago where you kept asking, how can we get a medical response instead of just a police response to these crisis calls? Conversations years ago, Ann, made a difference down the line. So it's just many people on this call do work that I so appreciate, but I wanted to call the two of you out in particular. Thank you.